Today we'll talk about the structures passing through the greater sciatic foramen and the lesser sciatic foramen. For that, you need to have an idea about hip bone. So suppose this is a hip bone of the left side. Here you have the sciatic foramen. This is a greater sciatic notch, right? And here you have the lesser sciatic notch. This is the greater sciatic notch and this is a lesser sciatic notch. In an articulated bone, that is with the sacrum and the vertebral column, and if you see along with the membranes and everything attached, you can see a foramen is forming. This is the greater sciatic notch into which the many membranes are attached, and it forms a foramen like structure which is called as greater sciatic foramen. And also the same with the lesser sciatic notch, the membranes are attached and which forms a lesser sciatic foramen. Now we are gonna see what are the structures passing to greater and the lesser sciatic foramen. The structures passing to the greater sciatic foramen. For this, remember the gluteal region and remember the muscles of the gluteal region. Okay, so we are gonna divide this into two parts based on the piriformis muscle. So imagine this is a piriformis muscle which I am drawing in the red color. This is the piriformis. Above the piriformis, you can see the gluteus medius and the gluteus minimus. So the nerve supplying this medius and minimus is the superior gluteal nerve. So above the piriformis, you see the superior gluteal nerve and vessels. And here is the piriformis. And below the piriformis, you can see inferior gluteal nerve, which is supplying maximus. This is the maximus, right? So after that, you also have the inferior gluteal nerve and vessels. And then you have the pudendal nerve, internal pudendal artery, nerve to obturator internus, posterior cutaneous nerve of thigh, sciatic nerve. Okay, so I said the trick to remember all this is imagine the gluteal region. Okay, the first imagine the muscles of it, right? So here you have the medius and the minimus, so the superior gluteal nerve and vessels. And after that you have the piriformis. This is the second one, and below the piriformis you have the inferior gluteal nerve and vessels which are supplying the gluteus maximus. Okay, so after that you have the pudendal nerve and internal pudendal artery. Okay, and then you have the obturator internus. This you also have the posterior cutaneous nerve of thigh and the sciatic nerve. Obviously in the major nerve of the posterior region of the thigh is a sciatic nerve, right? So you're going to remember it. And after that you also have the posterior cutaneous nerve of thigh, and then obturator and the pudendal nerve and artery. So, and also out of these are all the structures of the greater sciatic foramen: the superior gluteal nerve and vessels, the piriformis, inferior gluteal nerve and vessels, pudendal, internal obturator and posterior cutaneous, and the sciatic nerve. Sciatic and the posterior cutaneous you're going to remember because it is present on the back side of the thigh, which is a major nerve. And also posterior cutaneous, as the name suggests, it is a cutaneous nerve which is present posteriorly on the thigh. So these two you are going to remember. And the extra things which you should remember are the nerve to obturator internus. As you know, you have a muscle here called as obturator internus. So obturator internus muscle is supplied by nerve which is called as nerve to obturator internus. You need to remember this pudendal nerve or internal pudendal artery. So these are all the structures passing from the greater sciatic foramen, out of which this obturator and the pudendal, remember these terms, nerves or vessels related to these terms are going to pass through lesser sciatic foramen too. That means the internal pudendal artery will be passing through the lesser sciatic foramen, and the pudendal nerve will be passing from the lesser sciatic foramen. Nerve to the obturator internus will also be passing from the lesser sciatic foramen. So obturator internus tendon, obviously that is a muscle, right? So tendon of it will also be passing through the lesser sciatic foramen, the nerve to obturator internus and the pudendal nerve, internal pudendal vessels. These are all the structures which will be passing through the lesser sciatic foramen.